Good afternoon, everyone. My name is Christine Burke, and I'm a program coordinator in the MCW Office of Community Engagement. Welcome to the March edition of our monthly Community Engagement Spotlight Series. Please note that this session is being recorded. I'd like to begin with a statement from the Office of Community Engagement. We wish to acknowledge the Indigenous people who are past and present stewards on the land on which we pursue our just cause of a healthy community for everyone. To our audience members, please be sure you are muted throughout the presentation. We encourage everyone to use the chat bar freely to share comments or pose questions for our guests. We will be monitoring your questions throughout the session, so feel free to send any as they come to you. Please look for information about upcoming guests on our CE website. You can find our series webpage by Googling MCW CE Spotlight. This monthly series features community partners and the important work that they are doing for and with the community. We highlight their goals, motivations, and accomplishments, and the ways that they have partnered with people and programs at MCW. To bring awareness to National Colorectal Cancer Awareness Month, the March Community Engagement Spotlight was planned in collaboration with the MCW Cancer Center. Today, we are deeply honored to have G. Smith joining us as our featured guest, along with our facilitator, Dr. Charles Rogers from the MCW Cancer Center. At this time, I would like to introduce our Senior Associate Dean for Community Engagement, Dr. Stacy Young, who will say a few words about G and the important work of G's Clippers and MKE Wellness Clinic. Dr. Young?
Great. Thank you so much, Christine, and welcome everyone. Perhaps like others or like me, maybe some of you were smiling during that wonderful song to open up the spotlight. I love that song, Stand By Me. So thank you again for joining us this afternoon. I'd like to first just take a moment to recognize the really unfortunate and senseless act of violence that occurred at Covenant School, the shooting at Covenant School recently in Nashville, and really for all those in our communities that are dealing with any form of violence in their homes, in their neighborhoods. We recognize in the Office of Community Engagement that these are public health issues, and when they affect anyone in our community, they really affect all of us. And our work continues, and our work in partnership is really to walk alongside individuals in the community and with community organizations that are always striving to improve health. With that, I'd like to provide some introductions for today's spotlight. Mr. Gaulien G. Smith is the founder and owner of G's Clippers, a Milwaukee barbershop, and G's MKE Wellness Clinic. G opened the doors of G's Clippers on June 1st, 1995, with just 4 barbers and himself, and has grown it to a 30-chair barbershop. The barbershop has created community partnerships with the Milwaukee Bucks and with numerous other large companies in the Milwaukee area, and he and his staff have been the barber or stylists to hundreds of professional athletes, politicians, and celebrities for the past 27 years. G's MKE Wellness Clinic is a health clinic in the barbershop that provides healthcare and awareness to individuals in the community. G has worked collaboratively with Froedtert Health to support skin cancer screenings and will be supporting colorectal cancer education. G and G's Clippers are known and respected because of their relentless commitment to the community, whether giving time, money, or resources to toy drives, coat drives, feeding families in need, or creating safe spaces and platforms, including men to talk about challenges such as their mental health. G is always connecting with the community. G's Clippers was the first barbershop in the country to charter a Boy Scout troop, creating significant avenue for mentoring. G's Clippers has received numerous awards and recognition for its important work in the city of Milwaukee and across the globe. Thank you, G, for being our featured spotlight guest today. I would now like to introduce today's facilitator, Dr. Charles Rogers. Dr. Charles Rogers is a behavioral scientist and master certified health education specialist and currently serves as an associate professor of epidemiology and social sciences in the Institute for Health and Equity at MCW. He is an MCW Cancer Center Research Scholar Endowed Chair and the inaugural Associate Director of Community Outreach and Engagement for MCW's Cancer Center, the founding director of the Men's Health Inequities Research Lab, and an associate member of the University of Michigan Mixed Methods Program. His career has allowed him the opportunity to study, partner with, and be a vociferous advocate for the underserved and socially vulnerable groups, including community-dwelling older adults, African Americans, homeless, Somali individuals, adolescents and young adults, and Hispanic, rural, indigenous, and minority populations. Charles is committed to dismantling systems of oppression to ensure equitable health for all. His transdisciplinary training in applied mathematics and statistics, health education, public health administration and policy, community-based participatory research, and cancer-related health disparities provides a unique perspective for translating research findings into prevention methods among government agencies, policymakers, private healthcare organizations, and communities. Since 2018, Dr. Rogers has been awarded over $3.3 million in funding for his community-engaged mixed methods research, aiming to eradicate inequalities in both colorectal cancer screening completion among African American men and early onset colorectal cancer among individuals younger than the previously recommended colorectal cancer screening age of 50. Charles, thank you for serving as our facilitator this afternoon, and I will now turn it over to you.
Awesome. Thank you all so much for having both of us, as well as the warm introductions. So before we get to the man of the hour, I wanted to share brief details to remind each of you that it is Colorectal Cancer Awareness Month. This March, the color for awareness is blue. So you may have seen several buildings, specifically 13 of them, lit blue across the city early this month. So I'm going to share instead of stop my video. Awesome. So for some of you, you're overdue for screening. And so maybe this talk will be the catalyst that reminds you to get that done as soon as possible. So again, do not sit on it any longer. Get screened for colorectal cancer ASAP. So for me, in terms of my work, I focused on Black men because, as you can see here, Black men have some of the highest chances of being diagnosed with colorectal cancer compared to all of the male populations. It wasn't until this year that we were surpassed by American Indians and Alaska Natives. You can also see that there's disparities also for Black men in terms of actually dying from colorectal cancer as well. And again, prior to this year, Black men had the highest chances of being diagnosed with colorectal cancer and dying from it compared to everybody, males and females. If you even look at our female counterparts, you can see too that Black women also have higher chances of being diagnosed and dying from CRC compared to other populations. This is unacceptable and a huge problem. Colorectal cancer is preventable and curable with early detection screening, yet disparities across the state exist. Here's an example of some marketing from Minnesota several years ago that you see on billboards: be there for her, get a colonoscopy. And a colonoscopy is a type of screening that's effective at detecting precancerous polyps so they can be removed before turning to cancer. But there's various screening options for colorectal cancers, such as stool-based exams, the sigmoidoscopy, virtual colonoscopy, or a DNA stool test, better known as Cologuard. And so what we like to say at the end of the day, the best screening is the one that gets done. So, but the problem doesn't stop there. There's been debate for several years in terms of the screening age. And so in 2008, the American College of Gastroenterology, ACG, actually recommended the screening age be lowered to 45 rather than 50 for Black people, because we as Blacks will be diagnosed with CRC at an earlier age, as well as a more advanced stage. Well, 10 years later, 2018, is when the American Cancer Society actually recommended that the screening age be lowered to 45 for everybody rather than 50, because colorectal cancer among younger people has been on the rise at about 2 to 3% every year since the mid-90s. Well, 2020 is finally when the United States Preventive Task Force actually drafted a B recommendation. B is not necessarily A, but it's enough for us to make change that screening be lowered to age 45 for those at average risk. And so as of now, based on 2021 information put forth by the American College of Gastroenterology and the task force, 45 is now the new 50 for colorectal cancer screening. So what this means is, because the task force put this recommendation forth, now insurance companies will cover you getting screened at 45. But is 45 low enough, considered the recommendation for Blacks has been there since 2008? And even more concerning is by 2030, researchers predict that colorectal cancer will be the leading cancer killer among people ages 20 to 49. Again, by 2030, that's 7 years from now, colorectal cancer is predicted to be the leading cancer killer among people ages 20 to 49. This is unacceptable. So as I wrap up with time, because we want to make sure, again, we can highlight the minute of the hour, when I've done some capacity building in, parts of Africa before the pandemic, and I was in a governor's chambers, I concluded reminding people about some of the risk factors and symptoms that are there for CRC. Some of the risk factors back then were older age. That's not the case anymore. If you have a colon, you can get colon cancer. Having a family history of CRC, a diet that's low in fiber, high in fat, eating lots of processed foods, red meat, not being physically active, diabetes. I have this highlighted because, consumption of like high fructose corn syrup in terms of like sodas, et cetera, that can increase your risk of diabetes. That's something that's very popular in African countries, et cetera. Obesity, smoking, as well as alcohol. But we kind of get those symptoms as well, such as blood in your stool being shaped like a pencil or ink pen, constant feeling of being full, bloating, changing your bowel habits, such as like you're not being able to go to the bathroom for 2 or more days, serious constipation, or rapid weight loss, and you're not eating more vegetables and working out in the gym. And I'll be remiss if I didn't include there also could be no symptoms at all. So at the end of the day, your body is always trying to remind you about things that's going on with it. And so pay attention to it as much as possible. Any questions out to today, please follow with me in any kind of way possible. Thank you for your time. Allow me to briefly discuss why you or someone close to you should not sit on it any longer. Get screened for colorectal cancer ASAP. Awesome. So I'll transition right into our man of the hour. Can you hear me, young man? Can you hear me?
I can hear you. I can hear you perfectly fine. How you doing, Dr. Rogers?
I'm doing good. I see you almost every week now. I think that's good though. I think that's good.
Definitely, without a doubt. Yes.
Awesome.
Great.
Awesome. So let's get to it. So our first question for you, for the audience to learn more about you, from growing up on North 7th and West Melvina Street to first cutting your brothers and friends' hair at age 13, please tell us a little more about yourself.
Well, that's where it all started in terms of the barbering itch. And then from that, at 21, it wasn't until I was 21 that I decided to make barbering out of my career. And I went to Pro Schools of Cosmetology, and it was a year program. I went to the full-time program and decided to go to school. Decided to open my own shop after working at Heroes New Image, which used to be on Fond du Lac and Capitol, just off of Capitol Drive. I worked there for like 2.5 years and decided to open G's Clippers June 1st of 1995. So I had like four of the barbers that was with me at Carol's New Image to come down with me on to open G's Clippers at Sherman and Fond du Lac. And hey, the rest was history, man. It's been a fun ride since. Been able to make some amazing relationships, impact a lot of lives, and get empowered myself.
That's awesome. That's awesome. I want to be like you when I grow up. My next question, to my understanding, G's Clippers was born nearly 30 years ago. How did it all begin, and how has it thrived despite the pandemic?
Okay. G's Clippers has grown tremendously over the years. Like I said, in 1995, I opened with the 4 other barbers. In 1998, I expanded I had 6 stylists on one side of the shop, and I had another storefront right adjacent to it, had about 10 barbers. So at some point, just on Fond du Lac Avenue, we had about 16 operators over there. And it wasn't until 2006 that I decided to open up a shop on MLK, not this location, but across the street in 2006. And I went down to 12 operators on Fond du Lac Avenue, 20 operators here on MLK. And then it wasn't until 2017 that I decided to take all of my 30 something odd, individuals, downsized by like 2 or 3 barbers, and I brought everybody over here to this location, and it's been a great ride. I mean, being able to open up this clinic that I'm in right now. This is actually the health clinic, G's MKE Wellness Clinic I'm in right now, which we opened 3 years ago. Been able to really impact a lot of lives through this clinic. But over the years, I've developed some amazing relationships. I've been the barber along with some of my barbers. I have been the barber for many NBA athletes, a lot of Bucks players for the past 27 years. A lot of celebrities have come to Milwaukee, like the intro stated, and a lot of politicians. This really has been quite the experience, and a fun ride too. I wouldn't change it for anything in the world. I actually recently talked to a friend of mine that I worked with at the post office. That was the last job I worked. I was early 20s, 20, because I actually was cutting hair and working there at the same time. And he said, man, just think, man, we were actually wondering why in the world are you quitting working at the post office to go cut hair? But man, we didn't see this. I said, well, I didn't see it either. Just a result of just, hard work and believing,
I do. And the more you're talking, the more I'm trying to be like you when I grow up. So keep up the good work where me and many others are watching it and taking note. And so you mentioned briefly about, G's MKE Wellness Clinic. So for those who may be unaware, tell us a little bit more about what that actually is.
Well, G's MKE Wellness Clinic is about a 12 by 12 room in my barbershop, in the rear of the barbershop. If you have never been into G's Clippers here, it's an old bank, an early 1900s bank. It's an 8,000 square foot facility. And I have 30 barbers. The floor is like a NBA court, actually a replica of the Bradley Center with a Froedtert Forum. Look at me talking about the old center we used to play in, but Froedtert Forum floor. And in the rear of it is this 12 by 12 room that was totally outfitted. And it looks literally like a regular doctor's office. And in this clinic, the programming is done by Anthem, Blue Cross Blue Shield, and the nurses and a lot of the initiatives that take place in the clinic is done by Froedtert. This has been an amazing relationship with Froedtert and the medical college. Jasmine is our nurse, our RN on staff here, which have served to be amazing, built great relationships with a lot of the clients that come through the doors. But in this clinic, you can get your blood pressure checked, your blood glucose level. You can, get information, from an actual RN on different health challenges that you might have. She can steer you in directions, where that can definitely help and assist whatever your questions might be. And it's just a whole gamut of things and things that we plan on doing in the future too. So I want one to be able to come to G's in the future and get their prostate exam, their a colon guard, or some of the other things. I mean, we at one point we did HIV tests, STI, STD checks, and things of that nature. So we're in the process. COVID has really slowed down a lot of that, which we hope to get back into doing some of those things. But what we offer now is, like I said, just light checkups, if you will. Basically, what we want to do is just inform the clients as much as possible on their health, get them to start understanding, how to, have the more proactive approach rather than reactive approach to their health.
Fantastic. I'm glad you briefly mentioned the pandemic because that's been a reality that is real for all of us. Can you give us a little bit of some of the secret sauce on how you continue to thrive as a shop as well as a clinic despite the pandemic?
The pandemic was tough, Doc. When I tell you the pandemic was tough, because we literally shut down. G's Clippers shut down. When I tell you no haircuts, no income from the barbershop is coming in, you know, so it was quite challenging during that time. But you know, God made it happen. You know, hey, we just, you know, when we did open back up, you know, we had all the safety measures in place. I got the whole thing, you know, the whole shop sanitized, and I kept getting it sanitized and disinfected, you know, after we open, and so clients can see. I'm posting pictures and videos on social media about things we were doing. Then gradually we opened the clinic up, and we had a great partnership with Hyatt Pharmacy, which we'll still have that partnership with them. So they were administering the COVID vaccinations and the boosters and flu shots, and we still offer that here at the clinic as well. When I tell you, man, it was tough, but hey, we survived. We survived, and we were able to, you know, help a lot of people, you know, get those vaccinations. Because, you know, at some locations you had lines, you know, around the corner, you know, getting the COVID vaccinations, you know. So at G's Clippers, you was able to come in. Initially, it was appointments, but then you were able to just come in and just wait, you know. And Jasmine, I think Jasmine took part of doing the vaccinations as well, but she was definitely here assisting. You know, it might have been nurses from Hyatt, come to think about it, that was administering those vaccinations. But we were able to help a lot of people, to say the least. We've really been doing our part to be what I feel a barbershop should be in the community that it resides.
Awesome. Congrats on so much success and kudos on this everything that you've done. I want to keep saying I'm going to be like you when I grow up, but I think it's going to get old. So I won't say it this time. I may say it closer to the end. So my next question is, what has it been like to partner with the Froedtert and the Medical College of Wisconsin Health Network? I'm
gonna tell you, man, Froedtert has really, this relationship with Froedtert has taken this clinic to heights that I never thought of. Man, we have done CPR trainings here. We have some workshops coming up. We've done individuals that might have had issues with, you know, issues with their skin. We had 4 dermatologists come in. When I tell you that was, and we did that twice now because of the success and the audience that came out for the first one. I mean, and to just hear, you know, the conversations in terms of what the future looks like, you know, with the relationship with Froedtert and the Medical College and G's Clippers. I'm very excited, you know, and one would ask, you know, do people actually come, you know, to the barbershop to, you know, to get these things, you know, checked on them? Like, yes, you'd be surprised. I mean, for the most part, I would like to think that, you know, a lot of, you know, the community have a better relationship with their barbers than their own doctors, surprisingly, you know. But it's been an amazing relationship. They are always there to help, assist, give resources. It's so cool. I mean, we have access to many doctors, nurses, medical professionals. I love it. I'm so excited for the future, what the future holds for this relationship.
That's awesome and definitely very admirable. And so some people on our chat today, they may be a little confused about how can they be more successful about partnering with the community. And so can you give a little insight in terms of, from your own experience, what you have learned about what it takes to be an effective partner?
What I think is definitely gotta be mindful of knowing how to play in a sandbox with other companies. I believe that's important, you know, to just listen, you know, really, you know, pay attention to what the community needs, and align yourselves with individuals in the community that share the same mission, if you will, you know, that have an audience, you know, that they have a passion, you know, to expand, more than just their four walls. I think it takes all of that. I mean, it's extremely important to know your partner as well as possible and what their mission is, first and foremost. Because I mean, now more than ever before, everyone should see the importance of the professionals coming to the community. It has been proven to be successful with, it just, you got a lot of individuals that might not, want to, do the whole parking garage thing or pay for parking or just have the transportation to get to wherever it is. And to have a place that you can set up shop at, if you will, join forces with a community business or hub or whatnot, and just bring whatever the resource is to the people. It works. It works, and this is proof.
Great. So you definitely have dropped a lot of major keys and gold nuggets for people to grasp on. But can you go a little bit deeper in terms of, if people want to effectively engage with the community, how does one go about building that relationship?
I mean,
let me give you a case study.
Give me a case study.
This is a case study.
Give me
So
something.
so you heard this dude, some brown, bald-headed dude, over 200 pounds, who liked to eat, was moving to Wisconsin, and he does something with barbershops and colon cancer. And they said he wanted to meet you. That's your case study. How does it happen? How did it happen? How do we get where we are today in a short amount of time? Somewhat.
That's something. I mean, and it's weird. Yeah, like the home bridge. The home bridge lighting was where we actually formally met. But what I think that how that happens is being a part of a lot of the community events, being a part of, a lot of the awards banquets, the 40 under 40 that just happened, the Black Achievers event. You have a lot of community power players, if you will, at those events. Social media, exercising, that's a free resource, right there. Being involved in a lot of the, the community organizations like Social X, young professional groups around the city. I think aligning yourselves, with those individuals through those platforms. I think that, I can see that really working. And then paying attention to the community partners or the community hubs, if you will, that's making a lot of noise and doing some great work already. That I could see being a great avenue to expound upon, if you will, or build a relationship. And if they don't have the capacity to bring you in as a partner, hey, they might know someone else that it might, look like it could be a possible great marriage.
That's so good. That's so good. I'm thankful that I'm finally able to have your cell phone number. But it's not having your cell phone number that's key. It's having your cell phone number and you respond is what's key. So I'm glad to finally be in the number, as some would say. I will
always respond to you. I will always.
Now that's because the relationship is there. That's why. Not because I got your number, because of the relationship.
Yes.
Awesome. So let's shift a little bit and go a little even more personal and deeper. And so, as you know, and thanks so much for partnering with me and our team so much on bringing awareness this month. So March is Colorectal Cancer Awareness Month. But for some people may not know that it's definitely had a huge impact on you personally. How has colorectal cancer impacted you personally, G?
Well, in 2006, May 7, 2006, my dad died of colorectal cancer. And my dad found out he had colon cancer late in the game. When I say late in the game, we're talking about stage 4, advanced stage 4, actually. And we didn't know a couple years prior to him passing. He basically was self-medicating himself, by, he was a coper, if you will, meaning he just thought he had lazy bowels. So he taking laxatives to pass his stool after a large meal. And one day that those laxatives wasn't working. And he hadn't had a bowel movement in about 3 days and had some major abdominal pain. And he went to the doctor, and they found out he had colon cancer, and it was pretty advanced. And he didn't live long after that. But he went and got second opinions and things of that nature. He tried a little, some radiation and chemo, but it was just too late. I mean, it was too late. And the wild thing about it is, my dad was really one of those guys, full of energy, very popular. A lot of people knew him. He was seemingly, in great health, slim, trim, didn't look at all a sickly man at all. Because if you didn't know, he didn't know either, that you would think he was the healthiest man alive, and still working, he was retired from the Milwaukee County Transit, but he still worked on the people's homes. He did home improvement work. And he was only 62, so he was seemingly in great health, like I said, and to just be here today and gone tomorrow, it was almost literally like that. And he was a guy that never went to the doctor. He had never got a colonoscopy. He was not that guy that would ever be sickly. I've never known my dad to go to a doctor's appointment or to be in the hospital at all. And it wasn't anything different, than what I saw in men in the barbershop. It's what made the perfect sense to bring the medical professional to the barbershop or to the people, because the people is not going to the doctor. I can honestly say, if this clinic was here back in 2005, 2004, Dad would probably still be here. Although we know it takes, on average 10 years for a polyp to grow into cancer, but it's just sad. I mean, if he would have went at 50 years old, when, back then it was like hardcore 50, go at 50, go at 50. Pops was 62 before he ever had any conversation about this colon that I knew of.
Yeah, thanks so much for sharing. That important story. It's like a gift and a curse. And a gift in terms of one, how because of that happening, it's changed you in more ways than one as relates to the importance of your health. And I'll ask about that shortly. And a lot of people on this call know how you are adamant about what you eat and how you are physically active. But, I'll make sure that the audience is aware that, we want to make sure you take home today that colorectal cancer is preventable, beatable, and treatable with early detection screening. And so in the case of G's father being diagnosed with stage 4, he had less than a 15% chance of survival. At that time, it was probably more than 10%, because that's what the rates were when I first started this work over a decade ago. But, if the individual was diagnosed early, like stage 0 or 1, they have a 90+% higher chance of surviving. So early is on time is late is unacceptable. And the other thing that I'll note here that we can learn from G's story is that family secrets can kill generations. Because we know the family history now with G's father being diagnosed with colorectal cancer, G could have said, I know that he didn't go to the doctor, and I'm not going to the doctor because I got to work. I got to make sure my family is fine. I feel like, this makes me a homosexual or something if I get screened with this exam, that's a colonoscopy, et cetera. But instead, that's not what G did at all. What did you do instead, G?
I mean, and it's just funny. Just listen to, to the couple things that you've stated. I mean, of course, I've heard it all. I mean, it's really sad, but that's just misinformed. That's the stereotypes that individuals have as it relates to the colonoscopy. When I tell you the colonoscopy, man, I've had 4 of them now to date. I got my first one when I was 38 years old. Because of my dad died when I was 36 years old. 38, my insurance was able to cover the colonoscopy. So I got it at 38 years old. He died when I was 36. I got it done when I was 38. And every 5 years after that, I've never missed getting it done. And I encourage all 5 of my brothers and my sister to get their colonoscopies done. And I live my life making sure I do what I can to converse with every single person I'm in touch with about, their health, about checkups and things of that nature. Is important. I mean, is in my cold conversation pitch, if you will, and it's totally preventable. Like, it's the most preventable cancer out. You cannot get colon cancer if you get a colonoscopy. Just go get a colonoscopy. What, it was 50 years old, now I think it's 45. Just go get the colonoscopy. It's totally painless. It used to be the toughest part about getting a colonoscopy was the day before, drinking that big gallon of fluid to clean out your colon. But now that process is even easy. I mean, you don't have to drink as much. It's, I don't know if it's a stronger medicine or whatever that cleans out your colon, but even still, the day of, like the morning you go get the colonoscopy, you don't feel anything. You're sedated. When it's over, you don't feel anything. I don't see how anyone can really honestly have an issue with it if informed correctly on how it is. I mean, I have no problem. Actually, to be honest with you, I think I have 5 now today, because I had mine every 5 years. But then I had 1 because I run marathons now. Because I'm so, to your point, I now focus on my health like tremendously. I mean, I'm really focused on my health. I don't eat, and I'm not knocking anybody to eat beef or pork, but I chose not to eat beef or pork. Fried foods is a treat for me, which I try to keep that to about once a month. I eat baked or broiled food. I eat a lot of vegetables, a lot of salads and things of that nature. And I picked up running marathons about 5 years ago, actually, with a surgeon there at Froedtert. He's the chief surgeon of the surgical oncology department for Froedtert, Dr. Gaulien, who is a very good friend of mine. So him and I have ran 5 marathons together. We ran Boston Marathon, New York, Chicago, Berlin, Germany, London, and he just completed Tokyo, which is which was the 6th of the 6 major marathons. So I wasn't able to make it, so I'll be doing Tokyo in March of next year. So that's been a fun ride. Now, I mean, till I die, I'm gonna always focus on my health and try to encourage as many individuals as possible, because it's not about the quantity of life. It's the quality. I don't want to live to 92 years old if I'm not really being able to do the things that I want to do. And it's just, I want to be able to truly enjoy life. I mean, Dr. Gaulien and I have also, we actually hiked 2 of the tallest mountains in New Mexico. We went on a 100-mile 10-day hiking trip. So I want to, we talked about maybe hiking Kilimanjaro in Africa, so, I mean, I just encourage everyone to, not only get their checkups, but encourage other people. Encourage as many people as you possibly can, because you only got 1 shot at this. You got 1 life. 1 shot at this. And it's always better to have a proactive approach than a reactive approach.
I completely agree. And I'll use these in some spaces. I'll say that every day you're either helping yourself or you're killing yourself. And it's up to you. And that varies from what we're eating, from how much we're stressing out at work, to how much sleep we're getting. It's all connected. So I greatly appreciate you sharing that. How can we get more individuals in our community screened for this preventable, beatable, and treatable disease?
I'm, doing things of this nature, having platforms, having individuals in the community, showing people in the community that they know, that they respect, being more vocal about getting the colonoscopy. I think a lot of guys don't know that it's the most preventable cancer out. They don't know that the prep is not as a lot like they may have heard. They probably don't know that the actual colonoscopy is totally non-invasive, and they won't feel anything. They don't know. It's just so many things that they don't know. So I think being present in the community, whether it be, through, signs, flyers in community organizations, to talks of this nature, to individuals that, you're trying to get, individuals that's in the community that the individuals might know, that the community might know, talk about their experience. Because I have no problem. I tell people from rooter to the tutor exactly what I did, exactly, what to look for, and how just a walk in the park it was. And it's not like I just had one. It's not like I just had two. I've had at least 4 or 5 colonoscopies to date, and have never had a bad experience.
That's fantastic. Before I go to taking a few audience questions, I want to wrap up with a few more questions for you. So one, how can we support your work in your community?
Whenever you see things that I might post on social media, please repost it, tell somebody about it, tell somebody about it, tell someone about it. Or if you see that you have an idea, that can maybe heal our community in whatever way. I mean, don't hesitate. Send me an email. Send me, give me a call. I'm basically here to be the help that I feel that God has placed on my heart and gave me the stage to do. I believe it's not by chance that G's Clippers is where it is. It's not by chance that we've been on Good Morning America, in the Washington Post, Washington Post, New York Times, LA Times. I mean, we have that stage for a reason, and I don't take that lightly. So I believe it's my responsibility to give, to be a blessing to the community, because I believe I live by to whom much is given, much is required. So one can help, G's Clippers, just by being present, being a part, and whatever, share the news, give more ideas. Yeah.
Awesome. I definitely was about to say that, and you said it yourself too, how much is given, much is required.
Yes.
What would you like people to know about your organization?
Just that, G's Clippers is a place that what you see today in G's Clippers is what I envisioned barbershops were back in the 40s, 50s, and 60s, where we truly was the heartbeat of the community, where good news was shared, where politicians could even speak to their constituents, where the barbershop truly healed the hood. And that's what I'm doing here. And I just want people to know that G's Clippers have the mindset of community first. It's funny, so many individuals said they look at my Instagram page and they have to forget that it's a barbershop, because I have to remember to post pictures of haircuts and things of that nature. I mean, I post so much about what we do in the community. I'm really big in mental health as well, awareness. I have platform once a month, every third Monday of the month. Myself, community activist, Kwabena Anton Nixon, and the Milwaukee Father Initiative, Tasha, that runs that program, along with WCS. We are doing some amazing work in the city when it comes to creating a platform for men. It's a men-only talk every third Monday of the month. We've been doing it for over 5 years now. So if anybody on this call, please, if you know anybody that for any man that that might need to be around some men, get some jewels, get some insight, input, might be struggling in some areas as a man, whether it be child support, whether it be just knowing how to represent and walk in a room as a man. Send them down to G's Clippers, 5 o'clock in the evening, every third Monday of the month. When I tell you, it has been a blessing to so many men. So yeah, we do so many things here at G's. Just stay tuned to follow G's Clippers on Instagram and follow G's Clippers on Facebook, and you'll definitely stay informed on what's going on.
Awesome. To take a question or two from the audience, one of the questions from the audience is, what are you most proud of thus far when you reflect on your community impact?
Oh, hands down, the clinic. This clinic has been, when I tell you, has opened my eyes and my heart, like you wouldn't believe. I got a friend, and I have no problem saying his name. I should know he don't mind me saying his name, but Curtis Jones. He's been a client of mine for over 20 years now. He's 62, 63, I want to say. Well, Curtis was just like my dad. Never really went to the doctor, and he's spoken publicly about this what I'm about to share with you. So he had never got a colonoscopy, never got a prostate exam and things of that nature. Anyway, he went, because of a conversation I had with him, he went to get a colonoscopy. He was fine with that. But the prostate exam showed that he had cancer. So thank God it was still the early stage. So he had the surgery, he did the radiation and all, but he thanked me to this day. It's funny, I cut his hair today. He's one of my few clients I kept, because I did retire from cutting hair just to try to do some more of this community work. Some more work I'm planning on doing, just trying to broaden my reach. But at any rate, yeah, so yeah, he's so when I hear stories like that, I'm like, I tell people, it's not about what you do for a living, it's how you do it. I did not see this 28 years ago. And I live my life in that life is God's gift to you. What you do with it is your gift to God. And I thank God that he allowed me to see what my purpose was at such a young age and live in that purpose. And my purpose be one of servant leadership. And I am hands down sure, without a doubt, that this clinic is the one thing that I'm most proud of to date, because I'm able to impact so many lives, and inform so many individuals, reach so many individuals. I mean, and then it just spearheaded into other things too, with this, being birthed, 3 years ago, it birthed so many other ideas in my mind and heart, how I can impact the community in just so many more ways.
Awesome. And my last question is, recognizing the assets of barber and beauty shops is becoming more familiar in the public these days. But what would you say can you speak a little bit on the importance of healthcare delivery systems actually investing in you all, like it's what's happening with you all? So you understand what I'm saying here?
I think I do. What I will say to that is, I always say is 2 businesses in the urban community that can truly change the trajectory of that community. One being the barbershop, the other being the church. If you guys think about it, you have an audience. We have an audience, that come through the barbershop, that trust us. And in G's Clippers, I have thousands of people coming through these doors every single week. I have a few thousand people coming through this door every single week. Just look at the impact. Look at the impressions that will be in front of your brand or whatever it is you're trying to share with the community. And the same thing with the church. We are trusted. For the most part, we are trusted individuals. So for you to invest in barbershops across the across the country, across the city, across the community, my God, the impact that can be made is insurmountable. Insurmountable. I mean, I see it firsthand, you know, and it actually, it brings me to, you know, what I really aspire to do. I would love to go around the cities all across the United States, identify barbershops, see who would be a great candidate for putting a clinic in the barbershop, so they can then, you know, truly understand what their reason is in the community. Because I just think there's a lot of barbershops and churches that's not really answering the call. I just think that they really don't understand the true impact that they have. I mean, it's really, to be honest with you, it wasn't until recently, I want to say the last year, I actually kind of been pondering opening up another barbershop in other parts of the city of Milwaukee, you know, to see if I can help this community and get this community engaged and let it be a normal thing to have health clinics in the barbershop. I want it to be normal. I want other individuals to do this. I shouldn't be the only barbershop in the whole state to have a full health clinic. Now, it is a barbershop. My buddy JP in Madison, Wisconsin, he has a health component to his barbershop. But I mean, here you have Jasmine here in this clinic, literally performing, weak shots, blood pressure, just the whole gamut. I wish I just had the whole list of the things that we offer here at G's MKE Wellness Clinic. But I want more barbershops to be of help to their community, like G's MKE Wellness Clinic.
Awesome. So we have dropped in the chat all the services you have provided, as well as the Facebook link as well. I think we need someone to drop in the Instagram link. That would be helpful. And so as we wrap up, you can cue those slides for me, Kelsey. We want to thank each of you for joining us for this hopefully informal yet very formative conversation today. It would not be possible without each of you joining us, and it would not be possible without the person of the hour, Mr. G. Smith. So let's join me in giving a virtual round of applause with emojis and notes in the chat, showing G some love for the time that he has given us today. Here you go, some claps right here. And you can see these can't too be loud. Again, thank you all for joining us today. This will be online, recorded later if you want to share with others who didn't miss it. Continue to stay in contact with us in terms of the Medical College of Wisconsin community engagement, as well as the Medical College of Wisconsin Cancer Center community outreach engagement. This is just the beginning of our great partnership for a lot to come. Thanks again all for your time. I hope each of you have a great day. And again, happy Colorectal Cancer Awareness Month.